Meaningful Medicine is a Novant Health podcast bringing you access to leading doctors who answer questions they wish you would ask. From routine care to rare conditions, our physicians offer tips to navigate medical decisions and build a healthier future. Dr. Shaoleen Daly is an internist and pediatrician, and she's here to discuss developmental signposts for kids 6 to 8 years old. Dr. Daly, welcome to the podcast.
Thank you so much for having me today. I'm very excited to talk about our topic today.
Me too. So many questions. Let's start with this. What are some of the most common physical and behavioral changes parents can expect to see in kids 6 to 8 years old?
Yes. So in regards to physical development, at this age, they're a lot more agile, a lot more coordinated. They can run in zigzags, jump down the steps, do cartwheels, catch small balls with more ease. Their strength and endurance is also improving, which is why they end up engaging in a lot more complex sports such as soccer and basketball, climbing. Their coordination begins to improve as well. And so they can start riding two-wheeled bicycles. And the other fun part is that now they're also starting to get some baby teeth that are now going to turn into adult teeth. So you'll start noticing the baby teeth are falling off. So this time is a lot of various differences. But behaviorally, now they're starting to become more self-aware. They're attempting to gain more independence. Their parental influence is no longer as much of a factor, and now it's more of their peer-to-peer relationship and their friendships. So those are just some of the few physical and behavioral changes I would say at this age.
Yeah, and you were mentioning sort of the emotional side too, the independence and sort of exploring further away from parents. How can parents tell the difference between normal emotional ups and downs versus something that might need more attention, like anxiety or ADHD?
Yes. So I always say the rule of thumb is if this, whether it's anxiety or ADHD, it becomes excessive. It's persisting for weeks to months. It's causing significant distress. It's impairing their functioning at home, school, or with their peers. They're not wanting to go to school. They're avoiding things that they used to previously like doing, such as going to the park, playing with friends, or they're constantly complaining about stomach aches or headaches without any medical cause. So when we're starting to see more of these symptoms, which is when we start worrying that there's an underlying anxiety involved, or if they're unable to complete tasks in multiple different realms of their life, school, home, then we get concerned about ADHD. But ADHD, it's a whole topic in itself where there's so many other underlying factors that actually could manifest as ADHD. But overall, I say if it's a short term and it's just transient, then there's nothing to worry about and they're still doing well in every realm of their life. But if they're very much becoming socially withdrawn, not wanting to engage in their previous activities, then I say that's worrisome.
Mm-hmm, mm-hmm. Another thing that can change our food habits, and there's more picky eating or really strong food preferences are common at this age. When should a parent worry that this is affecting a child's nutrition or even their growth?
Yes. And I say for kids who have developmental disorders such as autism or any developmental delay, I really try to emphasize that we ensure that they are getting a full balance, but sometimes they're so picky. So we really want to make sure they're getting additional resources for those, whether it's with the nutritionist, whether they're getting Ensure or some sort of additional nutrition. But for our more healthy kids, I say one solid meal that has at least proteins, fruits, veggies is all we need. One solid meal is all right. And then trying to always offer everything on the table. And, and what you're eating, I always say, whatever the parents is eating is what the kids are eating. So parents, if you're not eating veggies, your kids aren't going to eat veggies. So always making sure that we're offering everything we can and just hoping. And we always check their weight at every well-child check. So as long as they're gaining weight beautifully, that's great. And they're not only having cake at every meal, then that's good.
Yeah, which can affect your digestion, which can affect bathroom habits, which is also a common thing for parents to be concerned about at this age. What is normal when it comes to things like bedwetting or constipation in early elementary school?
Yeah. So typically, bedwetting by 6 years old, they should no longer be having bedwetting behaviors. But often, if they're very intertwined. So many of our kids who have some constipation issues where they're having pain when going to the bathroom, or they're having pellet-like stools, or they're straining and screaming going to the bathroom, that's concerning for constipation. And that in turn can often sometimes cause some incontinence. So if there is incontinence past 6 years old, then I do get a little worried and I do evaluate for constipation. Um, but often bedwetting at night up to 5 to 6 years old is normal, but after 6 to 8, especially, that's when we need to start looking at other underlying causes.
And we've talked about how school is now more demanding and there's more challenges and there's more investigation of independence. So all this is happening. What should parents watch for with school related challenges like focus, relationships with peers, or academic pressure?
Yeah. So school related pressures, they are, at this age, as I had mentioned earlier, they are becoming a little bit more driven and becoming more goal oriented. And so I say that when school related challenges are occurring is when if they're having difficulties with focus and attention, such as easily being distracted, unable to complete tasks, losing materials or losing their homework, their backpack, their pencils. That's one thing to be definitely concerned about. And we should evaluate for attention deficits. And then if they're having peer relationships, such as they're having social withdrawal, conflicts with their friends constantly, having low self-esteem, not wanting to do schoolwork, or being rejected by their peers, or not wanting to attend school because of bullying and other poor peer-to-peer relationships. That's where we also, I would say, need to intervene and to further investigate. Um, and then other things that I would say is that, and again, these are, and it should be distressing and it should be consistent as opposed to just transient here and there.
Another really important factor, really for adults as well as children, is sleep. But kids definitely need their chunks of sleep. How much sleep do 6 to 8 year olds really need? And what if bedtime becomes a point of contention or even a nightly struggle?
Yes, I think this is the biggest issue that I'm seeing with my 6 to 8 year olds, especially now with so much screen time. So, 6 to 8 year olds should be getting about 9 to 12 hours of sleep per night, and they should be going to bed at an early bedtime, around at least 7 to 8, like 8 to 9 p.m. at latest. Um, and so I say, and this sleep is so important because it decreases your risk of obesity, high blood pressure, depression, diabetes, and academic difficulties. And some of the barriers I'm seeing with children having poor sleep is that they're having bedtime resistance. They want to stay up later. They're having some insomnia at night. They some kids are drinking caffeine early at this age. They have irregular bedtime routines where during the week that they go to bed early, but then on the weekends they're allowed to sleep later. So that becomes infrequent as a schedule. And then another one is they have their screens in their room. They have their tablets and other electronics in the room, which become a barrier. And I say like how, and how, the thing that I advise for my parents is always creating a consistent bedtime routine. I say the 4 Bs, bathe, brush your teeth, read a book, and bedtime. That's very important. Get rid of technology at least an hour or 2 hours before bedtime, so it's not consuming in their head. And sometimes the kids want to go to sleep late. And so I say, then you need to do a reward system, such as a bedtime pass. You're allowed 5 passes a year to stay up and past a certain point, and that is it. So, so sleep has been quite a challenge, I feel, especially in this age as they're also testing their limits and testing their parental control.
And then, like a lot of us, kids don't always think they're tired, but if they relax and lay down, gosh, they really are.
Yes, yes.
Are there any health screenings or doctor visits that are especially important during these early school years?
Yes. So we really evaluate during this time for such, we look at the weight. That's how we make sure weight, BMI, blood pressure screenings we're doing at this age, just to see if, to ensure that they're getting their proper appropriate nutrition. We talk about screen time. I do see how much screen time they're having, how much sleep they're having. So a lot of our just general questionnaires really gives us a good gauge on how they're doing. Other things I do try to screen for is any types of depression if there's any issues. Another thing, it's a little bit more for the 9 to 11-year-olds is where I check for cholesterol levels, but sometimes if there's significant family history or concern for weight, I will check it earlier.
I like the way our discussion has really addressed the whole child, the physical side, the emotional side, screen time, which is such a big factor, those outside factors, school and health screenings and doctor visits. As we wrap up, I would love to know how this topic became a passion of yours. What drew you to focus on pediatrics and internal medicine?
Yeah, so for me, it's always been about connection across the lifespan. I was drawn to MedPeds because I love seeing the full story from a child's early development to the behaviors and habits that shape their adulthood. The 6 to 8-year-old stage is very fascinating. They're gaining independence, but still deeply influenced by family, environment, friends, community, and just understanding those intertwining dynamics helps me support kids in that moment, but also guide families, how we can build foundations for both healthy lifestyles for them as children as we're trying to create good habits, and also good habits for the adults who I also often see. I see their parents as patients. So this blend of curiosity and impact is what keeps me passionate about my work.
Well, Dr. Daly, thank you so much for all this great information. I think you probably put some minds at ease and alerted others by sharing your expertise.
Awesome. Well, thank you so much for having me. I really enjoyed being on this podcast.
For more information or to find a physician, visit novanthealth.org/services/pediatrics. And for more health and wellness information from our experts, visit healthyheadlines.org. Meaningful Medicine is a Novant Health podcast.